long-term use of proton pump inhibitors may not be good for your body, may not be good for your blood vessels. It's been shown now by our group and others that users of PPIs are at increased risk for dementia, heart attack, renal failure. So we now have the mechanism. We now have the smoking gun that explains these observations. It raises the question of whether these drugs should be over the counter. Should they be used without medical supervision? I think not. I think that the regulatory authorities should reconsider the use of these drugs over the counter. There are some people that absolutely need these drugs. They have severe GERD, severe heartburn, and they need these drugs. There are other drugs on the market other than PPIs, but other antacids that could be used. What we found in this paper was that those cells that form the lining, human endothelial cells, exposed chronically, long-term, to proton pump inhibitors, age faster. And the reason for that is that there are little structures in cells called lysosomes. They're like garbage disposals. They get rid of the junk that's accumulating in the cell. We found that the proton pump inhibitors are impairing the ability of those little garbage disposals to make acid. They don't work as well. Garbage is accumulating. We actually can see that in the endothelial cell. Over long periods of time, garbage is accumulating. It causes stress on the cells, and they age faster as a result. And they can't function as well. They can't proliferate as well. They can't do their job. Long-term studies of vascular health have not been performed in people taking the proton pump inhibitors. We need to do those studies. We need to determine if the findings that we have right now really apply to our patients, really apply to people out there in the community that are taking these drugs. So I would love to have my colleagues in the scientific community help me with this, and we're certainly going to get started here at Houston Methodist on this study.